Hello, cruel world. My name is Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. You can call me the ominous Sohominous. This is the second and final part of my videos about myths about psychopaths. I will be outlining 5 more myths about psychopaths for all y'all. This video also contains another video inside a video about 8 emotions that you might feel if you're friends with a psychopath. I'll be answering questions like, is psychopathy linked to a violent childhood? Are psychopaths and sociopaths the same thing? No. And a philosophical quote about psychopathy. Okay, so as I said, this is part 2. My first video explained what an actual clinical psychopath is and isn't. I dispelled some myths such as psychopaths all being violent criminals, about that women can't be psychopaths because girls is players too. I explained the difference between males and female psychopaths. I told you about whether or not psychopathy can be cured. So I know what you're thinking, my Psych for sore guys and gals. Why not just do one video with like 10 myths? And the answer is simple, because things go well in 5s. You have 5 senses of the human body, 5 deadly sins, Snow White and the 5 dwarves, whereas 10, there's not 10 of anything, is there? Okay, before we start, just to put everything in context so this video makes sense, I'm going to give you a very brief description of what a psychopath is. I've actually formally diagnosed and worked with psychopaths in my job as a forensic psychiatrist, so I've seen them face to face. This is not just shit that I've Googled, honestly. So a psychopath is not just somebody who lacks emotions, but it's somebody who's very manipulative and charming, and they're very parasitic, so they manipulate other people around them to get what they want. They see everybody as like a stepping stone to gain something from. They don't really have true friends, they only have opportunities. As I said in my first video, about 1 to 2% of the population in the UK are clinical psychopaths. Before we start, I'm just going to, just because I think it's interesting, I'm going to tell you where the term psychopathy and the concept came from. It started in the early 1800s. The groundwork for the concept of psychopathy can be traced back to a French psychiatrist named Philippe Pinel. And he described patients who appeared mentally sound but exhibited impulsive and antisocial behavior. He called this condition manie sans délit, which is madness without delusions. You're right, that was an amazing French accent. And then moving on, in 1888, the term psychopath itself is credited to a German psychiatrist named J.L.A. Koch. Well, there's nothing funny about Koch. He introduced the term psychopathy, otherwise known, translated directly as psychopathic inferiority, in 1888, and the term was used to describe a broad range of mental disorders and social problems. Into the early 1900s, the general concept of psychopathy gained traction, different interpretations emerging. Some psychiatrists use it to describe a specific personality disorders, whereas others used it as a broader general term for various mental illnesses. Okay, enough foreplay, let's get into myths about psychopaths. Number 1 myth about psychopaths in this video is that all psychopaths have a violent childhood, i.e. violence causes psychopathy. The exact cause of psychopathy is unknown, but it's likely to be a combination of genetic and environmental factors. So what I'm saying is there's a higher chance of developing psychopathy if a close relative has it. And when we talk about environmental factors, then absolutely early childhood experiences, negative experiences, can preclude an individual to have it, like abuse or neglect or a chaotic upbringing. All of this can increase the risk of psychopathy. But notice that's not all necessarily violence. So you can have emotional abuse, neglect. But if you have these things when connected with a genetic predisposition, that can lead to psychopathy. So it could just be that a child is being bullied, or it could be isolated. So again, non-violent ways where a child can be screwed up and eventually becomes a psychopath. They could also get mixed messages. So they can have like quite a bindful relationship with their mother that's very confusing with them, and they don't know whether. So at one point they're being shown love and affection, and another moment hostility. So as I say, mixed messages, unclear messages from the mother, being emotionally manipulated. When I was just a little baby boy, my mama used to tell me these crazy things. She used to tell me that my daddy was an evil man. She used to tell me he hated me. but then I got a little bit older and Another risk factor is brain development. So some studies suggest that those abnormal brain structures and functions might lead to psychopathy. So to be specific, the prefrontal cortex is a region of the brain that plays a crucial role in decision making, also in impulse control and emotional regulations. And studies have shown that psychopaths may have reduced grey matter in the volume of their prefrontal cortex. Not just everywhere, specifically the ventromedial prefrontal cortex and anterior cingulate cortex. Don't worry, I don't know what any of that stuff means either, and I went to medical school. So all of this can contribute to their difficulty with empathy, with understanding remorse, with planning for the future. All of those things makes an individual more impulsive. On top of that, there is often abnormalities in the hippocampus, such as a smaller size or asymmetry. All of this have been observed in brain scans in psychopaths. So just so you know, a hippocampus is an area of the brain involved in memory and learning, not, as I thought, a zoo for gay animals. So why was all of this relevant, all these problems with learning from past experiences? How does that make you a psychopath? Basically, it means that punishment is not effective. So you know that saying, once bitten, twice dry. So say if you stole a Snickers bar from your teacher's desk and she pulled down your pants and slaps your bare ass in front of the whole class, most people would become so mortally embarrassed by that they would learn from their behaviour. They won't steal the Snickers again, or at least they won't get caught. Whereas a psychopath doesn't learn from previous punishments. As an example of clinical psychopaths that don't have any known childhood trauma or issues or problems, there are a few quite high profile ones. Probably the one that jumps into my mind is Joanna DENNEHY, who went on a stabbing spree. She is a female serial killer from the UK. I've actually done an entire video on her and her killing spree. Always be plugging. I'll leave the links in the Shmom and Shmection. Also Lucy LETBY. Now Lucy LETBY, I don't think is a psychopath. That's a whole different conversation. Again, I've done loads of videos on her. Always be plugging, and I'll leave the links. But she is somebody who's done something horrific, who doesn't have a history of known childhood trauma or any kind of problems in adolescence, growing up, etc., etc. Okay, moving on. Myth number 2 about psychopaths: it's easy to spot a psychopath. So you might think, and especially what's shown in films, that psychopaths have like shifty eyes and creepy smiles. But in reality, psychopaths are not easy to spot visibly or even emotionally, because they're very charming and they're very charismatic and they blend in seamlessly, so they're difficult to detect. So it's not as simple as facial expressions. So this is normal. Psychopath. Normal. Psychopath. Constipated. Normal. Dr. Grande. Oh no, he didn't. Okay, moving on. As we're talking about knowing or being able to spot whether somebody's a psychopath, that leads to a very interesting topic, I think, which is emotions that you might feel if you're friends with a psychopath. So here are 8 of them. Let's get started. Emotion number 1 that you might feel if you're friends with a psychopath is initially charmed. So psychopaths can be very charming, charismatic. They might shower you with attention and excitement. They might make you feel that the friendship is special, and it might be quite intense and exciting at the beginning. So if you're thinking, we love your steez, Dr. Das, but is charmed an emotion? Yes, it is. Stop questioning me. Number 2 emotion that you might feel if you're friends with a psychopath is manipulated. So as the friendship progresses, you might experience manipulation. Psychopaths are very skilled at playing on your emotions to get what you want. So they can drill down to find what your weakness is. So do you have a guilty conscience? If so, they might use guilt trips. Or is it flattery? Or is it even threats? Anything that they know will work on you specifically to control your behavior. They can find your weak spot. Number 3 emotion, if you're friends with a psychopath, is revolted, due to their lack of empathy. So you might find it difficult to connect with a psychopath on an emotional level, because they might struggle to understand or share your feelings, or indeed anybody's feelings around you. And that in itself might make you feel isolated and also unheard by that individual as a supposed friend. Number 4 emotion that you might feel if you're friends with a psychopath is insecure due to their unpredictable behavior. I make myself sick, get on my own nerves, immature, insecure, grown-up nerd, has been MC on a label that's unstable, chopping bliggy on the table. The friendship might be quite unpredictable. So psychopaths can be impulsive and they're prone to risky behavior. And even though, as I said, initially this can be great, it can be exciting, it can be energetic, they can be charismatic, eventually it can become quite stressful and it can become destabilizing. Number 5 emotion that you might feel if you're friends with a psychopath is ignored due to one-sided focus. So the friendship might feel very one-sided. Psychopaths are often self-centered and may only maintain their friendship as long as it benefits them in some way. So if there's drama, it's always about them and their lives. If there's conversations, it's always about their problems. They'll steer the conversation and the attention away from you and your problems. Actually, that's very similar to how narcissists behave. In fact, there's a huge overlap between the personality of narcissists and psychopaths. They're not the same thing. I've actually done a video, 5 myths about narcissists. Always be plugging. You should go and check that out. So as you'll see, that also contains a video about how you know you're friends with a narcissist. Some of the things are the same, though not everything. Okay, number 6 emotion that you might feel if you're friends with a psychopath is condemned by others because of your damaged reputation. So being associated by them could damage your reputation by proxy, or even you could have lies spread about you because of that friendship. And also their actions and their behaviors might reflect poorly on you by association. Number 7 emotion that you might feel if you're friends with a psychopath is isolated. So a psychopath might try and isolate you from your friends and your family, making you more reliant on them. And they might need you as an emotional crutch, and they're not going to give you up. That's actually quite similar to gaslighting. It's not exactly the same, but it's a similar psychological process, that bit. Again, I've done a video on gaslighting. Always be plugging. Go Chigfedy-check that out. Number 8 emotions that you might feel with a psychopath, and the final one is drained. So the emotional manipulation and the unpredictable nature of the friendship can leave you feeling drained. You might feel constantly on edge. You might feel exhausted. Again, similar to a narcissist. The difference is that a narcissist just does it for attention and your kind of collateral damage. They don't care about you or your fate, so that's why you feel drained. Whereas a psychopath does it for a reason that's not necessarily attention. Could be money, could be power, could be status, and they might actually get pleasure in damaging you. See my video about the difference between psychopaths and narcissists. Always be plugging. Again, links in the comments. Okay, myth number 3. Psychopaths are the same as sociopaths. Before I get into that, let me quickly introduce you to my channel. This is a Schmike for Small Minds. I do a smorgasbord of videos about mental illness and offending and the overlaps between the two. As you probably noticed, I've been doing a lot of these myth videos recently, so go check them out. Myths about female prisons, myths about murder investigations. I implore you to subscribe. Not only does it help me out immeasurably, but if you do subscribe, you'll never get a parking ticket ever again, guaranteed, or your money back. Okay, going back to the video, myths about psychopaths and sociopaths being the same. The reality is that even though they're used interchangeably, they're not quite the same thing. I'll tell you some differences. So one is in emotional processing. Psychopaths are characterized by a lack of empathy and remorse. Sociopaths have less empathy and remorse than an average person, but they can still feel them to some degree. So a sociopath can still feel guilty about what they do. Psychopath doesn't really. They might fake guilt because they've been caught, but they don't actually really feel it. Another difference in psychopaths and sociopaths is that sociopaths live on the fringes of society. So they're obviously sociopaths. They are drug dealers, they are thugs. Whereas a psychopath could be anybody because they blend in. They could be your neighbour, your lover, your gardener, that little old lady who does voluntary work at Marie Curie. They're chameleons, they blend in. You don't know they're a psychopath initially, unless you feel all those 8 emotions that I was talking about before. Another difference is that psychopaths tend to be more cunning and calculating and planning in their actions than sociopaths. Sociopaths are impulsive and reckless. They act out in the moment without considering the consequences. You piss off a sociopath and he will get angry there and then, and he will slap you across the face with a fish. You piss off a psychopath, he will serve that dish cold of revenge. He will poison you when you're eating your tiramisu 3 weeks from now. Okay, moving on. Myth number 4 about psychopaths is that you can easily spot them, diagnose them, there's a checklist, all of that good crap. So as an aside, I've actually used the psychopathy checklist, which is like a 20-item list to diagnose psychopathy on Anna Delvey from Inventing Anna and on Michael Jordan. Is Michael Jordan a psychopath? Go check out my video if you want to know the answer. I'll put the links in the comments section. So even though you can use this checklist, in reality, diagnosing psychopathy is complicated and it requires a trained medical professional like myself, simply because you need to know where the cutoff point is. You need to have done it on hundreds of psychopaths to know exactly what is just a slight extreme version of the trait versus what's actually pathological. And on top of that, you can't just rely on on the history from the person in front of you. You need collateral information. So you need to get objective evidence from other people that are not likely to lie to you, like partners, family members, teachers, etc., etc. Now here's something I'm going to say that's slightly controversial. I've mentioned the Hare's psychopathy checklist before, and I've done a couple of videos on it, as I said, Michael Jordan. I don't think it's a great checklist. I think it's quite flawed, even though it's kind of the most common, the universal one used in my profession. I don't think that's good, and I'll explain why. I think there are some flaws. There are some things that I think are absolutely key to being a psychopath, like pathological lying, like having a parasitic lifestyle. And according to the checklist, they have the same weight as some of the other lesser important factors, like being sexually promiscuous. So what I'm saying is, you can have somebody who could be a psychopath, in my view, who is a strong pathological liar, who has a parasitic lifestyle, but isn't sexually promiscuous, and they will score relatively low in the psychopathy checklist. Also, if you listen to part 1, my video about my first 5 myths, I talked about the difference in males and female psychopaths, and sexually promiscuous is really relevant because male psychopaths are much more likely to be sexually promiscuous as their motivation, whereas female psychopaths might use sexuality as a tool to manipulate greedy and sexualized men, but they're not generally that sexually promiscuous. So what I'm saying is this is a flaw in the psychopathy checklist because it's not that good at diagnosing it. Another flaw, I think, is there are some items that are very, very similar, like emotional behavioral problems is one, juvenile delinquency is another. Technically, they're not the same thing because you could still have early behavioral problems, like not getting on with your parents, bullying your siblings, and not be juvenile delinquency because you don't break the law. But in my view, there's such a big overlap that you're wasting one of the factors on having two things that are too similar. Similarly, impulsivity is one of the checklist factors. Poor behavioral controls. Again, they're not exactly the same thing, because impulsivity is not being able to control yourself in that moment and doing something impulsive and bad, whereas poor behavioral controls is not necessarily is having the time to think about it, not doing it impulsively and still doing something bad. So they're not the same thing, but again, I think there's such a big overlap that I think it skews the diagnosis of the whole thing. Whew, felt like I was rambling then. Okay, moving on. So a quick quote about psychopathy, just to change up the episode. This was by a famous philosopher, I think it was Socrates, who said, "I invented violence, you vile, venomous, volatile, vicious, vain, Vicodin, vrin, vrin, vrin. Texas chainsaw, left his brains all, dangling from his neck while his head barely hangs on. Bloods, guts, guns, cuts, knives, lives, wives, butts." Anyway. Moving on, myth number 5 is that psychopathy is permanent. Okay, so psychopathy is a personality disorder. A personality disorder is a deeply ingrained pattern of feeling, thinking, behaving. It's not a temporary state or a condition that can improve over time or with medication. So the psychopathy itself is permanent. It is unchangeable. And the core personality characteristics are unlikely to fundamentally change. However, despite that, there can be a situation where a psychopath's behavior can seem less intense over time. So hopefully you get the difference. I'm saying that the personality, the core is the same, but the outward expression can change over time. Here are some reasons why. There might be reduced opportunity. So as a psychopath ages, they might have fewer opportunities to engage in manipulative or impulsive behavior. For example, if they're a psychopath who's a CEO in the corporate world, they might no longer be in a high pressure work environment because they're retired. They might not have the same physical ability. So if they were a psychopath who was a criminal, who was a thug, who was a drug dealer, they might be physically less capable of murking one's ops. Also, the consequences of their actions might make them reflect on their behavior. So if they experience negative consequences such as jail time or damaged reputation, they might be more cautious or calculated in the future. And this itself might seem like their manipulative tendencies are decreasing. So what I'm trying to say is they might become insightful with therapy. I said this in my first video, that even though you can't cure psychopathy, with therapy, if you find out the particular triggers, anger management, drug and alcohol problems, for example, that might make a psychopath's behavior worse, you can reduce those particular triggers. So you can improve the behavior, not the core characteristic traits. I hope that all made sense. Okay, I've been rambling long enough. I think it's time we called it a day. Hope you enjoyed that video. Hope you helped you understand some of the myths about psychopaths. People use the term incorrectly all the time, so I hope that's helped to enlighten you a little bit. I make these videos because I want to educate you, my dear Psych for Sore guys and girls. I want you to start thinking like a forensic psychiatrist. Also want to take over the world. That's not going great. Let me know what you think of the video in the comment section below. Have a blessed day. Buy my book, and do not forget, I love you.